Hello, my name is John Effinger, and welcome to our Trust Team video series playlist on the Hastings Center for Bioethics channel. We interview our co-collaborators to hear what they have to say about working on this important project. We are a year and a half into this PCORI-funded Trust Team, which means teaming researchers up with stakeholders to test trustworthiness, engagement, and measure project. And PCORI is a patient-centered outcomes research institute which has funded this work. During this time, we have been developing a skill to measure organizational trustworthiness in community academic partnerships using community-based participatory methods. We are now looking for individuals to complete the survey to test this trustworthiness scale. If you have participated as a research collaborator anytime from January 2020 until December 2025, we want to hear from you. If you are an individual with lived experience of an illness, or a caretaker of someone with illness, or a representative of a community-based advocacy organization, or you are a clinician who collaborates on research projects but whose work is not primarily research, we also want to hear from you. Today, Dr. Mitchell Lunn is representing the PRIDE study, and he has joined us in this conversation. Our conversation is on historically disenfranchised communities, such as LGBTQ plus people, people from different ethnic populations, people who have an impairment or disability, and other populations who have had limited access to quality health care. Mitch, great to be with you today. We have known each other through the Pride Study Project for some time, and it's thrilling to have the opportunity to talk about your work in the Pride Study and what you're doing at Stanford University. Please take a moment to introduce yourself, and then we'll start with the questions.
Sounds great, John. Thank you so much for inviting me to be here today. It's really a pleasure. As you heard, my name is Mitchell Lunn. I use he and him pronouns. I'm an associate professor of medicine and of epidemiology and population health at Stanford University School of Medicine, where I'm also one of the associate deans for research. I am primarily a researcher who studies LGBTQ plus, or lesbian, gay, bisexual, transgender, queer, and other sexual and gender minority communities. I'm one of the co-founders and co-directors of the PRIDE study, which is a longitudinal cohort study of LGBTQ plus adults from across the country that's enrolled more than 30,000 folks that we've now are just going to soon be starting our 10th year of longitudinal data collection, which is pretty exciting. Clinically, I'm a nephrologist, a kidney disease doctor, so I see patients with electrolyte disorders, acid-base problems, kidney function problems, and refractory hypertension or high blood pressure in Stanford University Hospital. And I'm really delighted to chat with you today, John.
Yeah, and 10 years, gosh, and I remember the first survey on the iPhone.
That was actually even before we started longitudinal data collection. So that was
I
back in
know.
2015 or so. That's like 11 years ago, if you can
Yeah.
believe it.
So it's been a while. So great to have you here, Mitch. So
Thank you.
the first question, why did you join the Trust Team Project?
Yeah, so trustworthiness is such an important part of research, especially when you're doing research with human beings. And so I like to think about communities that have been underrepresented or disenfranchised, as you said, or really that have been not included in any biomedical research. Obviously, we know from the LGBTQ plus perspective that there have been LGBTQ people since the beginning of documented history. And we have also been participating in clinical research studies since the very beginning. But there has been really limited visibility of LGBTQ plus people in research studies and a whole bunch of other communities, obviously. And part of this is oftentimes because the trust has been broken really between communities and the medical establishment. And for in my world, that's the academic medical centers, but that it could include industry partners like pharmaceutical companies. It could include hospital systems. The medical system generally has really, in many cases, conducted really important transgressions against certain communities that have pushed them away from participating in research. So part of this is we really need to start rebuilding trust. And we don't really have a way to measure trustworthiness of an organization or of a particular group. And so this project was pretty exciting because it really addresses some of the root causes that limit participation in research. And when we limit participation in research, we limit the ability to then care for those particular communities, because we're missing the data, we're missing the evidence that we can actually that we actually need as scientists and as researchers to move the needle and hopefully create some actual impact for those communities that we're serving.
Yeah, and re-emphasizing the point, every voice counts, and
Absolutely,
that's the
absolutely. I
key.
think we've had so many folks that think that their voices don't matter, think that their opinions don't matter, think that their lived experiences don't matter. And in actuality, those are things that are probably matter more than anything else, to be honest with you, right? I mean, who really cares about the research question if the community doesn't think it's important, if the community doesn't trust the people doing that work? Are we going to get the right answers that we really need that are going to move the needle, are going to improve clinical care, or are people just not going to participate? Told so many times that nothing that they say or do matters. And so we really want to really kind of turn that 180 degrees so that they are really, as we often say in the Pride study, and many groups say this, that participants are our true north, right? And the organizations that we collaborate with are also organizations that we need to be sure we know are trustworthy and are doing work for the good of the community rather than for some other motive.
Yeah, good point. So next question, what have you learned from being part of this project, and particularly since we're developing a scale working with a range of partners?
Yeah, this project has been really, I think, informative and interesting and exciting. I've done a little bit of scale development work earlier in my career, and this project just reminds me how important it is, and two, how challenging it is. I think, especially when we're doing it in such a thoughtful way on the trust team, to involve multiple partners, multiple different identities, multiple organizations, different levels or different kinds of people, clinicians, researchers, community members who participate in research, organizations. There's really all these different kind of buckets of folks that are involved in this project, and all of their opinions are going in to develop this scale, this measure of organizational trustworthiness. And I just remember that there are oftentimes, kind of almost conflicting perspectives, right? And how do we actually try to figure those out and making sure that everybody's voice is heard, and getting down to I often say that people are in the weeds, and I think in many cases we need to be even at the microscopic level or the molecular level of those weeds in order to develop these scales and instruments in a really thoughtful way that will then hopefully have long lasting, be really durable in measuring trustworthiness going forward, right? And so it takes that really concerted effort to do that. And so I've been really impressed at the diversity of the stakeholders that are involved in this project, and at the organization of the project, to making sure that all those voices are being heard and incorporated into the project and into the scale development.
Yeah, that's fascinating where you talk about down to the molecular level, which I think that's a great metaphor, but also the downstream effect longitudinally. And, I think that goes back to the work that you're involved in. It's those longitudinal projects, it's not just doing something that's going to impact now, but how do we think about it going forward? So,
Right, and I think there's so much effort that goes into scale development, as you and others know, right? We've been in this project for a while, and we're plugging along now, and you want all that work to not just Ron, did I freeze, or is that just
nope,
oh
you're
no?
fine.
Okay, it was just on my end. Okay, so um, so I really want this work to continue, and to to be used, we devote all this time to the project now that it would be a shame if this measure is only good for another year or something like that, right? So that, because again, this measure is something that I hope will be used in a longitudinal way for organizations as well, to look at their hopefully improving trustworthiness from from their stakeholders, from their community members, from their advisors. And so, because scale development is so complicated and so time consuming, that it's really important to devise a measure, one that has all these different partners and folks involved, but also that will stand the test of time effectively and still be relevant. Maybe you and I can talk 10 years from now, and see if we're still using the measure that was developed as part of the trust team project.
That's great. We ought to put that on our calendar.
Yeah, we'll put that on the calendar now. Right. Yeah. I'll be 2036 will roll around and I'll be like, what is this meeting with John that I have on here? So,
well, since I turned 74 this year, I'd be happy to check in at 84.
Sounds good. Sounds great.
So, next question. How do you think about organizational trustworthiness and the impact on your decision to engage in research? And really, what role does the reputation of the organization play in your decision?
Yeah, I look at this from several ways. How we decide to partner with an organization is incredibly important, and it's incredibly important for me and my team and lab that we have, because we want to make sure that the people that we're working with are good, right? That they're going to do the work, that they're trusted by the community members, that they're trusted by us, that they're trusted by other people, that they're trusted in certain cases in the scientific community if we're partnering with a more research or scientific based partner. But also, we oftentimes partner, as you know, with organizations, and do those organizations have trustworthiness with their constituents, with their stakeholders? Because if we're partnering with them to help engage a community that we may not have as much insight into, per se, for example, an LGBTQ plus population in a certain geographic area, if the LGBT people in that geographic area don't trust that organization, that's not going to help our project succeed, right? And most importantly, the community is not necessarily going to get any benefit from that project happening, because they may decide that they don't want to be involved, right? And so, and then I think, on maybe the flip side of the same coin is as an academic researcher, I write grants for funding of research projects. And one of the things that is important in grant applications is that the organization, that the whole team has the expertise to do what you're proposing in the grant, right? And so if we're partnering with an organization that doesn't have that I don't have trust in, that they haven't had created some organizational trustworthiness through their prior work, their track record, their engagement with the community, are going to see right through that and are going to not fund that work. So this is really organizational trustworthiness is obviously very important for the communities that the organization serves, but I think it's also important for that organization's really continued sustainability because they get money from the grant applications as well as we do for the scientific side of things. There's really, I could probably go on and on and on and list a whole bunch of reasons why trustworthiness is really important for an organization, but we want to make sure that we're having a partner that we're partnering with to do the work, that knows how to do the work, that the community respects and trusts, so that they share their full breadth of experience, right? That all of their voices, their lived experience, the things that work really well, the things that don't work well, we want to hear all of those things. And in order to do that, people need to feel safe, have psychological safety to share that. And also, I think from a research participant perspective, you want to make sure that as a research participant that you're participating in a project that is done by organizations who know what they're doing, right? So I have the Stanford University name, which some people trust, other people do not, right? They've felt that Stanford has done, and this is the same for every really academic institution, that they may or may not trust them, right? They may have had a negative experience in a prior research study. They may have had a prior negative experience in the healthcare setting in Stanford's hospitals, right? That has just kind of tainted their entire perspective of anything affiliated with Stanford, right? And so similarly, organizations have those same, community-based organizations or other nonprofits have similar experiences. And so, trustworthiness is really a critical aspect of making sure that projects proceed. And what it also creates, which I didn't mention, is that especially when we're collaborating, is we want this free exchange of ideas. And I want folks that I'm collaborating with to say, Mitch, I don't think that what we're doing is right, and here's the reasons. Here's the reasons why. And in order for me to understand their perspectives, I need to trust them, right? If I don't trust them in the first place, I may blow off these perspectives. Well, that they're an organization that can't be trusted, so they're sharing a concern or an idea. But if they don't, if I don't trust them, I will be less likely to really have them be a full partner in our work.
I am so glad you used all the different examples that you used in there, because it's all part of what goes through people's mind when they want to think about participating and collaborating and then continuing forward, and particularly the point that you raised on the psychological impact that somebody has to think about as well. All important points. So, moving on, what would you say to folks like yourself about the importance of engaging in this survey, and then also thinking, I mean, you are part of another clinical and translational science award, or a CTSA award. Why would other CTSA awardees want to participate in this survey?
Yeah, I think participating in this survey is really important because we need those additional voices, additional perspectives, right? So we have the trust team, which is made up of the dozens of folks that are part of it, but dozens of folks that are part of it is not enough to really develop an appropriate scale. So we really need the voices of those clinicians who are primarily not researchers, of community members, of a whole variety of folks to take the survey and share their opinions, so that we can really make sure that the scale, one, is valid, and two, is really encompassing the breadth of items that go into each of our definitions of trustworthiness. And then, as part of the CTSA award, or the Clinical and Translational Science Award at Stanford, these are awards from NCATS, part of the NIH. All of these CTSAs really are focused on the science of translation, right? And so that's bringing discoveries from the bench, or maybe bench and community, to the community members broadly, right? And so part of this is, how do we do that? And so every single CTSA has a variety of to support clinical research. And that can include things like, participant recruitment and identification, community engagement cores, making sure that community members are involved in research projects, and obviously all the nitty-gritty science stuff, data, AI, population-based data, wearables or digital health. Many of the CTSAs all have these various components, and really are involved in many cases hundreds or even thousands of research projects. One that may occur just at their local institution, so CTSA based studies at Stanford, for example, but there are also cross CTSA or cross institution studies that take place. And all of these, again, trustworthiness is just as important in a CTSA as it is in the larger academic institution, as it is for community-based organizations or nonprofits, or really grassroots collections of folks. And so, again, because academic medical centers especially have maybe not done the best for certain populations in their history, that making sure that CTSAs are also trustworthy and are partnering with trustworthy organizations is another really important aspect. And I think that, probably 10 years ago, John, we were not really talking much about community engagement, right? And if you go back 20 years, community engagement was not a big deal. As time has continued to pass, community engagement broadly across health and medicine, especially, has increased because they realize that it is not necessarily the faculty members in their ivory towers that have the best research ideas. And instead, getting those ideas from the community are important. The faculty members have the ability to operationalize and conduct that research, oftentimes have more resources and infrastructure than a community-based organization does, but that doesn't mean that the community-based organization can't and shouldn't partner with the academic institutions. In fact, we now know that that's incredibly important. And so as we see the importance and the effort, and even the example that I now use is that community engagement participant experience is now a requirement by the FDA to get new drugs approved. And so if there's not a path in translational science to involve patients and research participants along the way, that's not going to be a successful project. And so we're seeing more and more evidence of needing community involvement, and CTSAs are in a really an amazing place that already have some infrastructure for community engagement, and so moving trustworthiness into that space as well is really a valuable aspect.
I'm two things that you raised there. One on the wearables, and thinking back of all the work that y'all have done on the NIH All of Us, and the amount and levels of data that is collected for that particular project, and the sharing of privacy information in there, and what that means for trust is key. And then the other one, it's community voices can really offer insights into what's needed. I remember on a prior project that I was involved with Texas Health Institute with genetics, and it was parents of kids that have genetic issues that were raising a lot of the issues that needed to be addressed. And then at the same time, also thinking about the uh, two projects that I'm involved with that PCORI is funded now, and the same type of thing. So,
Yeah, no,
uh,
you're exactly right. I mean, all of us, for folks who may not know what it is, this is a federal government initiative to enroll more than 1 million people across the country. Folks who participate in All of Us have survey data. They can choose to link their electronic health record data, and all 1 million people will actually undergo whole genome sequencing. So every single letter of everybody's genetic code will be deciphered and measured. And so this will be whole genomes of 1 million people, which is really incredible. Of course, there's a ton of concerns about data privacy and security and how that will be used. And it was, only because All of Us was a trustworthy organization, and they built trust by partnering with community organizations, with partnering with communities across the country. And that includes racial and ethnic minority communities, people in rural areas, people of lower incomes, LGBTQ plus people, people of different education levels, all of those groups, they were able to then say, oh, these concerns are actually concerns of many groups of people, and we need to be really transparent about how we're protecting people's data, how we're using taking in their voice and actually using that in appropriate ways, and then communicating that back to the community, and being really transparent about how their data will be kept safe and secure. That is just one example of a way that All of Us has tried to build trustworthiness, right? And that I always call this closing the loop, right? You go out to a community and get some answers, you then move to getting more perspectives, you eventually implement that, and then you need to report that back to the community and make sure that things are working well, and that you correctly heard and interpreted interpreted what the community was telling you. And so those, I think, are various ways that that All of Us has just one small way that they've built trust, but trustworthiness is incredibly important, and that, I think, has enabled All of Us, just because we're using that example, to be well on track for their 1 million people. They've now enrolled more than 800,000 folks. So so part of that wouldn't have happened if they wouldn't have been a trustworthy organization. And they, I think, were actually swimming upstream, right? They're a federal government study, and a lot of people do not trust the federal government. So they started with a pretty strong headwind, and I think have done quite well at building and now maintaining that trust.
Good points. And for those that are watching, looks like bandwidth on my side has stopped my video. So we're going to keep going because I don't want to interrupt this great conversation that we're having. We have one other question to go. So moving forward, what do you see as the impact of this project, and particularly impact for different communities? Does it change anything? And if so, what? And how does it contribute to improving healthcare as we move forward?
Yeah. I think from our side, this project, and especially once this scale is ready for use broadly, I think one of the first things that I think about using it for Pride Net, which is our community engagement arm of the Pride study. Both for Pride Net and for Pride Study, I look forward to using this scale, this organizational trustworthiness scale, to really work on improving our organization. So if we send it out to our stakeholders and we find out that there are certain areas that we are lacking in trustworthiness or areas for improvement, those I think are things that I would be very excited to know about and to work towards. There are so many aspects that go into to our individual definitions of trust. I can think about a community organization in San Francisco, and my definition of whether I trust them or not may be different than another person who lives right next to me. And so some of those, so I really view this as a way for organizations to ramp up their trustworthiness, first to identify areas where trustworthiness is has some areas for improvement, and then can actually devote resources to improving those areas to in turn gradually increase the overall trustworthiness of the organization. And I would like to see that done. I would love to see this measure picked up by other folks outside of academics, and really, kind of free flowing in the nonprofit and community-based organizations. I would also really love to see it for organizations that are for-profit, that touch a lot of people in very, and oftentimes very important and sometimes sensitive ways. So I think of healthcare systems, health networks, those sorts of things. Are those organizations also considered trustworthy by their people that they serve, by their constituents, by their communities? And so I hope that this project will really have a broad reach. And while we were talking at the beginning about that, I hope that this instrument lasts and is durable for 10 years, and we'll have our interview in 2036. But I also realize that trustworthiness, I think, also changes over time and as society changes as well. And so I also hope that this instrument does not actually just kind of stay the same for the next 10 years, but I also hope that other groups, whether it's the trust team group or future groups, also think about ways of improving its the measure over time, right? Iteration is really an important aspect, because we may find out that this instrument, this scale, has some areas of trustworthiness that need to be added to be assessed in the future.
The points that you raised on other nonprofits, community-based organizations making use of this, and for-profits, I hadn't even thought about that piece, but for-profits, and thinking about not just healthcare organizations, but people that are in the healthcare ecosystem that are for profits, and in thinking downstream, over the next 5, 10 years, the impact that things that you mentioned earlier, with whether it's wearables or ingestibles that track stuff, or anything that deals with new pharmaceutical drugs that are coming out. All of that is so important. So thank you for raising that, because that's something that we haven't talked a lot about in trust team meetings, and that's probably something we should be thinking about. So
Yeah, I think so. I mean, we're seeing obviously also this kind of exponential rocket growth of AI also, right? There are many people right now who are very distrustful or very suspicious of artificial intelligence, rightly so. But is there a version of this scale, of this instrument, that will be appropriate for assessing the trustworthiness of an artificial intelligence system, right?
oh
Do
wow,
I
what a thought.
trust, you know? So, so I don't know, right? There's going to be limitations to this scale. It's not going to be able to measure trustworthiness of everything and what people's opinions are. But I do think that, we really, I would love to see this scale, maybe with some, minor tweaks here and there, be able to measure things that we necessarily haven't thought about before.
But that's great to put that even on just our thought process now, much less, what do we do going forward, is how do you measure AI trustworthiness? So that's something to think about going forward. That's fascinating. So with that, thanks, Mitch. This has been fascinating. I just love all the time that we have a chance to talk. I learned so much from listening to you and all the work that you're doing. For people
Thank you.
watching, go
Thank you
ahead.
so much, John. It was really great to chat with you today. Really appreciate it.
Well, and for people watching this, there's additional information on our project. It's going to be found in the description. You'll also find chapter markers for key points as we go through this in there. And we look forward to seeing you for future interviews in the future. And with that, we'll call this one a wrap. If you'll stay on just a second, Mitch, that would be great. But we'll go ahead and call this a wrap, and appreciate everybody's watching this.